Hi, everyone. Welcome to Dental CE Academy. We're going to be starting here in just a few minutes. I'd like to do a quick sound check. If you can hear me, please type yes into the chat area. Great. Thank you so much. All right. I want to call your attention to the instructions in CE credit instructions as well. Tap on the red banner at the top of the screen or check your email. It was sent out about 30 minutes ago to everyone who was registered at that point. All right. If you need a little assistance, let us know by typing into the chat area. Again, for those of you that have joined us, welcome. We'll be starting here in just a couple of minutes. In the meantime, you will need to access the handout and CE credit instructions. Do that by tapping on the red banner at the top of the screen or check your email. For those of you that are joining us, be sure that you have the handout and CE credit instructions by tapping on the red banner at the top of the screen or check your email. For those of you looking for a quiz, if it's from a prior course, go to our website and tap on CE Credit Inquiry and send it in. We respond to all of those right away. If you are not getting a response, it's going into your spam. All right, so we do need your phone number. You'll include that in that form and we can call you. Okay, everyone. Hello, Dr. Moskowitz.
Good evening, Dr. Rowling.
We have got a large class, an exciting class this evening. They are ready to learn. And I'm going to go ahead and review the instructions right now. So for those of you that just logged in, you should have received an email from us probably 30 minutes ago with the handouts, the course folder, and the credit instructions. But you can also tap on the red banner at the top of the screen, and it will also take you to that folder. So the agenda for this evening, we'll have Dr. Moskowitz provide you with some information, PERI implantitis, what your patients can do to avoid losing the implant, and what you can do to avoid losing the patient. That presentation is 1 hour, 5 to 6. At the end of his presentation, he's going to allow some time for Q&A. So be sure to type any questions that you have for him in the chat area, and we'll make sure that we address those. All right. Following his presentation, there will be a presentation about Iotech International's molecular iodine oral health products. So please stay on for a few minutes afterwards and learn how to be able to get your hands on these products and try them. It is not required for CE credit, but we do hope that you will stay on. And with that, I will introduce you to Dr. Moskowitz. So Dr. Moskowitz is the chairman and co-founder of Iotech International. He is the co-author of Iotech's U.S. patent and global patent applications. He previously founded and served as chairman and CEO of Advanced Tissue Sciences and Life Medical Sciences, two publicly traded medical technology companies. He has also practiced clinical dentistry for more than 25 years, and he is a graduate of the University of Tennessee Dental School. So welcome, Dr. Moskowitz, and we'll be here in the background to help anyone that requires it.
Great. Thank you so much, Dr. Rowling, and big shout out to your audience. We've got a lot of material to cover. I think we'll be able to give you some useful tips. So let's jump right in. So tonight we're going to be talking about peri-implant disease and maybe some tips that can help to keep you out of trouble and also to help your patients keep out of trouble. So, as Dr. Rowling has mentioned, I'm affiliated with Iotech International, and we make some oral care products. And after the webinar, we'll be talking about some of those. So it would be useful if we first define peri-implant disease so that we know exactly what it is that we're talking about. And the first written to peri-implantitis was by an author, Mombelli, in 1987. And he coined the term peri-implantitis and noted that it was an infectious disease, and he compared it to periodontitis. He felt that it had many features common to periodontitis. Following that first definition of peri-implantitis, the first European workshop on periodontology refined the definitions. In fact, they termed peri-implant mucositis as an inflammatory response and involving soft tissue surrounding a functional oral implant. Okay, so this is an inflammation of the soft tissue surrounding a functional oral implant, and they termed peri-implantitis as similarly as an inflammatory response, but one that involves the loss of marginal bone, also around a functional oral implant. And the idea that those are basic definitions, it kind of gets clouded after that because a number of other authors have added their own features to the definition of these peri-implant diseases, and including requirements for bleeding, requirements for bone loss, or requirements for the amount of pocket depth. So depending on how the authors defined it, also made a difference in what they were able to determine with the number of cases that had it, because how prevalent is peri-implant disease? And it is not something to be taken lightly, because there was a meta-analysis which included the review of 110 studies, which involved over 12,000 implants. And what they found was that on average, 35.6% of those implants had peri-implant mucositis, and also 13.1% had peri-implantitis. So collectively, between the mucositis and the implantitis, you're pushing almost at 50%. So this is fairly significant. And so it's something we want to pay attention to, because we don't want to be on the wrong end of this. Okay, so so if we know what it is and we know how extensive it is, then let's talk about what we can do to treat it. So so first, let's talk about a definition of by the European Federation of Periodontology. And the European Federation of Periodontology essentially states that even though there are a number of possible causes of peri-implant disease, that the leading cause by far is the development of bacterial plaque surrounding the implant. And that's both a peri-implant mucositis and peri-implantitis, that they develop as a result of the accumulation of bacterial plaque. Now, that's not to say there are not other causes, but this is the principal leading cause. So therefore, just like with the first written reference, Mumbelli, they also indicate that, as with periodontitis, the treatment for peri-implant disease adopts the same principles of therapy as those used to treat gingivitis and periodontitis. Okay, so we're going to be using the same principles of treatment. Okay, so let's first talk about peri-implant mucositis. Okay, and that is much more simply taken care of. And it involves, firstly, an effective, and I emphasize effective, daily at-home oral hygiene regimen. Okay. Secondly, a frequent professional prophylaxis. Okay. So effective daily at-home oral hygiene and also professional preventive care in the office. Now, for peri-implantitis, it also requires, and it's critical, that we have effective daily at-home oral hygiene. That's the unifying theme for both peri-implant mucositis and peri-implantitis as to how this needs to be treated. So in addition to effective daily at-home oral hygiene, then initially, or the first phase of treatment for peri-implantitis is a non-surgical phase. And that's a professional treatment, which can involve prophylaxis. It can involve antiseptic irrigation. It's checking for any residual cement. And once that's done, at a 6-week evaluation or reevaluation, then if the bleeding has stopped, if the probing depths have decreased, then the patient can be scheduled for a recall, depending on your professional assessment as to when you would like to see that patient again. If the bleeding has not stopped and the probing depths have not decreased, then we're not going immediately to a surgical phase, but we're going to repeat that non-surgical phase. And that is the antiseptic irrigation in office, the prophylaxis. And if that's during that second phase, if antibiotics are necessary, they could be given, but only in refractory cases. And the reason for that is there is such an uptick in the amount of patients who are becoming resistant to antibiotic treatment. And it's becoming really alarming. And in fact, the study that was done at Temple University Dental School by Professor Rams, they found that in a 20-year period from the year 2000 to the year 2020, that for clindamycin and for patients that have severe periodontitis, that today, or that is in 2020, 20 years later, there's a 15.5 times as many patients who are resistant to clindamycin as there was 20 years ago. And for amoxicillin, 28 times as many patients are now resistant to amoxicillin than were 20 years ago. So this thing is a pretty large groundswell. So we only want to use antibiotics when it's absolutely necessary. For peri-implantitis, if we've progressed to the surgical stage, that is the non-surgical phase has been completed, then this can take the one of several different courses. One, it can be a grafting procedure or a procedure which involves bone regeneration. It could involve a recontouring or removal of irregularities in bone resection, or the implant itself can be intervened with so that the threads are removed, the visible threads are removed, and we have highly polished implant surfaces so that these surfaces are lustrous and also have less chance of causing irritation. And another modality that's also part of this construct is that we want to make sure that the soft tissue collar has a healthy keratinized aspect to it. So we want to make sure we have a healthy keratinized soft tissue collar, and there may be any one of a combination of these treatment modalities in order to be able to accomplish the final result. So surgical treatment for peri-implantitis. As far as this effective daily home dental hygiene, I can't emphasize this enough. This is a big deal, and the patient is actually primarily responsible for the health of that implant once it's been inserted. So the at-home modalities, obviously, are brushing, flossing, antiseptic rinsing, antiseptic irrigation, and antiseptic tray gel application. And as we're discussing these modalities, I just want to touch on the value of flossing versus rinsing. You know, we're taught in dental school, we're taught in dental hygiene school, the mantra, at-home brushing and flossing, at-home brushing and flossing, that these are the critical pillars of support for good oral hygiene. And brushing and flossing are important. But you should also be aware there are three classic studies that were done, each one 6 months in duration. And these were gingivitis studies. But these studies, the first two of these studies had over 300 patients in each one. These were controlled, evaluators were blinded. These were gingivitis studies. And in the first study, they compared at-home brushing and flossing for plaque reduction to at-home brushing and rinsing. So the net effect was that for brushing and rinsing, there was a 37.5% plaque reduction. And for brushing and flossing, there was a 2.1% plaque reduction. In other words, the brushing and rinsing was 18 times more effective in plaque reduction than was brushing and flossing. In the second study, also with more than 300 patients, the plaque reduction for brushing and rinsing was 20%, and for brushing and flossing, it was 3.4%. So the brushing and rinsing in this additional study was 6 times more effective in plaque reduction than was brushing and flossing. And in the third study, with 160 patients, here they evaluated the bleeding index, they evaluated the modified gingival index, they evaluated the plaque index. And for each of those indices, they compared brushing and flossing to brushing and rinsing. And here they used 2 different types of rinses, but either rinse, either one of those rinses with brushing was more effective as measured by each one of those 3 indices than was brushing and flossing. So better results from brushing and rinsing than from brushing and flossing. Okay, so what kind of rinses do we have? Well, some of the common antiseptic rinses used in your offices could be chlorhexidine gluconate, hydrogen peroxide, povidone iodine, molecular iodine, cetylpyridinium chloride, chlorine dioxide, or stabilized chlorine dioxide. And we'll spend a little bit of time on chlorhexidine gluconate because it's so widely used in dental practices and it's been around for so long. And it's been around for so long for good reason. It's active against both gram-negative and gram-positive bacteria, and those bacteria could either be aerobic or anaerobic. It's been awarded the ADA seal of acceptance, and because it's been used in perio care for such a long time, it's considered a gold standard as a chemotherapeutic agent for periodontal care. But all is now wonderful in the land of chlorhexidine gluconate. There's disadvantages, and those who've been using it know about many of these disadvantages. Firstly, the FDA has issued a safety warning on chlorhexidine gluconate because of the rapidly increasing number of allergic reactions. And in fact, for hospital use, 4 infants had actually died from anaphylactic shock associated with the use of chlorhexidine gluconate. Secondly, the FDA has issued recalls for microbial contamination of chlorhexidine gluconate oral rinse. So what are we saying? We're saying that bacteria were living inside the bottle of chlorhexidine gluconate oral rinse, right? And there have been multiple recalls for this microbial contamination. Chlorhexidine gluconate, if you look at the safety data sheet that accompanies every bottle of chlorhexidine gluconate oral rinse, the FDA requires that on that safety data sheet that it indicates that it is a potential carcinogen, and it is a category 1A potential carcinogen, meaning that the data that points to its carcinogenicity came from human data, not just from some obscure laboratory study. Also, chlorhexidine gluconate interferes with fibroblast proliferation and attachment. It interferes with wound healing. It interferes with gingival repair, which is kind of at odds with the idea that chlorhexidine is used so frequently for periodontal treatment. But if you're doing guided tissue regeneration, then chlorhexidine gluconate is working against you. We're certainly aware of its that it promotes dental calculus buildup, that it stains both teeth and tongue, and it either has a poor taste or it alters one's taste, and it's indicated for short-term use only. It's contraindicated for long-term or chronic use. It also, unfortunately, allows microbial resistance to develop. Right, and that's part of the reason why we have problems with these antibiotics. It compromises, and this is for patients who have implants or for where implants are contemplated, is that chlorhexidine gluconate actually compromises the biocompatibility of titanium surfaces. And it also inhibits osteoblastic activity or bony regrowth. And therefore, it's contraindicated for detoxifying implants. I want to compare povidone iodine to chlorhexidine gluconate. So, and that is for its activity in periodontal care. So, there was a study that was done which did just that. And they took a cocktail of 6 different prominent periodontal bacteria: Porphyromonas, Tannerella, Actinobacillus, Prevotella, Fusobacterium, and Streptococcus. And in that cocktail of bacteria, they exposed that cocktail of bacteria to chlorhexidine gluconate for 60 seconds. At the end of the 60 seconds, they found that there were more than 1,000 viable bacterial colonies remaining. When they exposed that same cocktail of bacteria to povidone iodine, within 1/4 the time, within 15 seconds, all of those bacterial colonies were destroyed, right? Much better results with povidone iodine than chlorhexidine gluconate. Povidone iodine not only is effective against periodontal bacteria, but it's also effective against periodontal bacteria embedded in a biofilm, right? So there was testing that was done at Tokyo University, the Department of Periodontology, and they found that a single 30-second application of povidone iodine was effective in suppressing both Porphyromonas gingivalis and Fusobacterium nucleatum in a periodontal pocket, and it provided support for the control of subgingival biofilm. So a single 30-second application of povidone iodine was effective in suppressing that biofilm embedded, containing both Porphyromonas and Fusobacterium. We're not only interested in the immediate effect, but we're also interested in the residual effect of our microbial agents or antimicrobial agents. And when they measure the substantivity, that is the ongoing residual effect of both chlorhexidine gluconate and povidone iodine, they found that chlorhexidine gluconate, after a single subgingival irrigation, was effective in keeping a decrease in the subgingival microflora for as long as 7 days. But with a single subgingival irrigation with povidone iodine, that effect lasted more than 4 times longer. It lasted 31 days. Now, if this slide characterizes povidone iodine and another antimicrobial rinse containing molecular iodine. The square on the left with all the red circles is a schematic representation of povidone iodine. 10% povidone iodine, the same way you get it from your dental supplier, the same way you get it from your drugstore or your supermarket. And we call it povidone iodine as if it's one thing. It's not. Povidone iodine is actually a dynamic equilibrium of several different species of iodine. It contains iodate, it contains iodide, it contains hypoiodous acid, it contains triiodide, it contains molecular iodine. And in aggregate, all these different species of iodine are present in povidone iodine at a level of 31,600 parts per million, a total of 31,600 parts per million. And here's something that is so unbelievable, is that of the 31,600 parts per million of total iodine, only 2 to 3 parts per million, just 2 to 3 parts per million, actually kill the germs. All the other atoms and molecules of iodine, of the different iodine species, do nothing to kill germs. They contribute to staining, they contribute to toxicity, but they don't kill germs. So in essence, about 31,598 parts per million are not needed because they don't do anything constructive. And it's just the 2 to 3 parts per million which actually kill the germs. Those 2 to 3 parts per million are molecular iodine. They're the one species of iodine in povidone iodine which is responsible for all of the biocidal activity of povidone iodine. All of the germ-killing activity is due to its molecular iodine and to no other species of iodine. Okay, so for decades, researchers have been trying to build up levels of molecular iodine in povidone iodine so that it would be more effective. At the same time, it would be nice if they were able to suppress the other species of iodine, which are not needed and are undesirable. And they haven't been able to do it. They haven't been able to do it because what is present in povidone iodine is a dynamic equilibrium. The, these species of iodine keep morphing or changing into other species of iodine. So if you were really able to add more molecular iodine in povidone iodine, it would not stay as molecular iodine. It would change into other of those species of iodine. That is until 2017, when the new generation of molecular iodine rinses became available. And unlike povidone iodine, these new generation, now let's look at the schematic on the right, where you see more blue circles. And the blue circle, by the way, is representative of molecular iodine molecules. So in these concentrated solutions of molecular iodine on the right, instead of 2 or 3 parts per million of molecular iodine, you have as many as 300 parts per million, 100 times more of the active biocidal species, and it's stabilized at those high levels, right? So it doesn't change into the other species, and also the other species of iodine are suppressed, and either suppressed or eliminated, so that the other species of iodine, instead of a total of 31,600 parts per million in the new molecular iodine rinses, is perhaps just a few hundred parts per million of total iodine. So since there's less total iodine, they're safer to use. And also, because there's more molecular iodine, they're far more effective. And if you look at the vial on the right, you'll see that's your typical povidone iodine, dark brownish, yellowish, deeply staining. The vial on the left was designed, it's a molecular iodine solution, which was designed to have the same level of molecular iodine as the vial on the right. So even though the one on the left, which looks like water, it's a molecular iodine solution that is just as strong, just as effective as the povidone iodine on the right. That solution on the left could have been made at 50 parts per million, 100 parts per million, 200 parts per million of molecular iodine, and be stable at those levels. So let's compare the efficacy of povidone iodine to molecular iodine. So for Staph aureus, povidone iodine completely inactivates Staph aureus in 5 minutes. And by the way, povidone iodine is a standard of care in hospitals around the world. Surgeons use it to scrub with. It's an excellent antiseptic. It completely inactivates Staph aureus in 5 minutes. But a molecular iodine solution can do the same thing in 1/10 the time, can do it in 30 seconds. For poliovirus, povidone iodine requires 15 minutes to achieve a 0.6 log reduction. Very, very poor activity. That's after 15 minutes. Yet with molecular iodine, after 90 seconds, poliovirus is completely inactivated. Gone, gone, gone. Now let's compare I2, a molecular iodine, to chlorhexidine gluconate, the standard of care in periodontal treatment. Okay, so for coronavirus, in the upper row, you see that chlorhexidine gluconate, a 5% solution of chlorhexidine gluconate, is able to achieve a 3 log reduction of coronavirus in 1 hour of exposure. 1 hour. Faculty of Pharmacy at the University of Lorraine in France was trying to get approval from the European authorities for a 5% solution of chlorhexidine gluconate as an antiviral agent against coronavirus. And they failed to do that because a 3-log reduction is inadequate to be considered an antiviral agent in Europe. It requires a 4-log reduction. Also, the idea that it takes 1 hour of exposure time to inactivate the virus, and also that it requires a 5% solution. 5% chlorhexidine gluconate is 42 times stronger than the 0.12% chlorhexidine gluconate oral rinse we use in the United States. So our chlorhexidine gluconate oral rinse is not going to do anything for coronavirus. And in fact, if you look at the next row for rhinovirus, chlorhexidine gluconate oral rinse 0.12% was completely ineffective. No biocidal activity at all when exposed to rhinovirus, common upper respiratory virus, after 30 seconds. Yet, a 25 part per million molecular iodine solution, which, by the way, is 1/4 the strength of the molecular iodine oral rinses which are available, at a 25 part per million molecular iodine solution, in 30 seconds completely wiped out rhinovirus. For Fusobacterium nucleatum, which chlorhexidine gluconate had a very respectable 4.29 log reduction after 15 seconds of exposure, molecular iodine was 100 times more effective. In the same time frame, 15-second complete inactivation with a 6.24 log reduction. And for strep mutans, the principal carriogenic bacteria, chlorhexidine gluconate achieved a 0.19 log reduction. That's the equivalent of starting off with 1 million strep mutans bacteria, and after exposure to chlorhexidine gluconate for 15 seconds, still had 810,000 living bacteria left over. Yet, in that same 15 seconds, strep mutans was completely inactivated by molecular iodine. There was an important study that was done last year that compared the antiseptic, a number of antiseptic rinses for their efficacy against 2 important periodontal bacteria, Fusobacterium nucleatum and Prevotella intermedia. The rinses that were tested, all were tested in the presence of saliva. Every single one of those rinses were tested in the presence of saliva. Why? Because salivary proteins inactivate most antiseptic rinses. So if you see study results which are purely in vitro in the laboratory, and they did not have fresh human whole saliva as an organic challenge, then the results are not realistic to what occurs in the mouth. All this testing occurred in the presence of saliva. The most effective rinse was the molecular iodine rinse. It completely inactivated both of those bacteria within 30 seconds. It went downhill from there. The next most effective rinse was the chlorhexidine gluconate rinse. For Fusobacterium, it was 28 times less effective than was the molecular iodine rinse. For Prevotella, it was 730 times less effective. The other rinses, the cetylpyridinium chloride, the chlorine dioxide, the povidone iodine, the hydrogen peroxide, the stabilized chlorine dioxide, all got progressively worse until they were hundreds of thousands of times less effective, to and including no biocidal activity at all. The same testing was repeated for the molecular iodine on 2 other prominent periodontal bacteria, Porphyromonas and also Tannerella. And also, in the presence of saliva, within 30 seconds, completely inactivated by the molecular iodine. So Not only is molecular iodine available for oral care as a liquid, it's also available as a gel. So it can be used in periodontal trays, full arch trays for at-home use. Uh, the gel can be applied in office with a syringe and cannula for professional infusion in the gingival pockets, or patients can use this at home very effectively with a full arch periodontal tray. These trays can be either a laboratory fabricated flexible tray, which your own lab can construct. Your office can do it as a suck down tray. And if you're doing it in office, you use soft EVA material, ethyl vinyl acetate, 3 millimeter thickness. It makes a terrific tray, very comfortable to wear. You only need to wear it 5 minutes a day. And a number of periodontists are using this for their patients for their moderate to severe periodontal disease because the tray holds the gel in place. And because the gel is more viscous than the clavicular fluid, and also it's held in the gel is held in place by the tray, then it resists any weeping of the clavicular fluids out of the periodontal pockets. So you get a very effective application, and only 5 minutes wear time is needed a day. Excellent, excellent results. Also, Perio Protect makes this a very suitable tray, as does Denmat. So molecular iodine is available as a gel. Now, here you have something which is so deadly to germs, But is it safe for humans? Well, you betcha it's safe for humans, because it's such a dichotomy here. One hand is so deadly to germs. On the other hand, molecular iodine or iodine is an essential nutrient. If we don't get enough iodine in our diets, we suffer from iodine deficiency diseases. Our bodies cannot manufacture iodine. We can't synthesize iodine. So that's why it's an essential nutrient. It must be gotten by dietary sources. And so it's uniquely safe for humans, and it's super deadly for germs. In fact, to give you an idea just how safe this is for humans, there was a study that was done in the United States. It was an FDA clinical study, multi-center, randomized, double-blind, placebo-controlled study. But this was not for oral care. This was for the treatment of fibrocystic breast disease. And the reason that they were even having this study at all was because in Japan, they found that women almost never got fibrocystic breast disease. But when those same Japanese women moved to either Europe or moved to the United States and adopted a Western diet, the incidence of fibrocystic breast disease in those same women rose to the levels of their Western counterparts, right? So they assumed that, or they hypothesized that it was probably the diet, because the Japanese diet is very rich in iodine. On average, the Japanese dietary intake of iodine is twice what it is in the United States. And in some areas, like in Hokkaido, Japan, the intake of iodine is 50 times as much as it is in the United States, and they take that in every single day. And you know what? The Japanese live longer than we do. They live 5 years longer than we do. They have better or a better history of or less heart disease. Several health parameters are better than they are for Americans. So they're living well on their diet. Whatever they're eating, they're healthier than we are. So because of that, that's why they chose molecular iodine to see if it would help with fibrocystic breast disease. So they made up 6 milligram molecular iodine tablets, and they had over 1,000 women ingest, swallow swallow a 6 milligram molecular iodine tablet every single day for over 6 months. Every single day for over 6 months. And because this was an FDA trial, that every week these women were examined by physicians. They had blood tests drawn, and they checked for iodine levels. They checked for any adverse events. There were no reported adverse events within that entire 6-month period for those entire over 1,000 women. And ingesting a 6 milligram tablet of molecular iodine every single day for 6 months is the equivalent of drinking, not swishing around, but drinking and swallowing 6 ounces of a molecular iodine oral rinse every single day for 6 months. No reported adverse events. Okay. And the other thing that's of note is that unlike glucosidine gluconate, molecular iodine is completely compatible with titanium implants. Okay. There's been misunderstandings about a sensitivity that may be caused by iodine. So it's been considered for quite some time that shellfish allergy is really an iodine allergy, and it's not. The medical literature has time and time again shown that it is a muscle protein, tropomyosin, which is the sensitizing protein that causes shellfish allergy, not iodine. Shellfish are rich in iodine, as is anything from the seas, because the seas are rich in iodine. Also, radio contrast media. Many of the diagnostic imaging agents, radio contrast media, contain high levels of iodide. And people have gotten frequent and severe reactions to that radio contrast media. But they've subsequently found out that it was not the iodide, but there are ionic excipients that we use in this contrast media. So when they swapped out those ionic excipients for non-ionic excipients, keeping the iodide constant, the instances of reactions, the severity of the reaction fell off dramatically, right? So it was not the iodide. And besides that, in the molecular iodine oral care products, there is no iodide. There is no iodide. For thyrotoxicity, now this is a concern, thyrotoxicity, because the thyroid gland is the gatekeeper that limits the amount of iodine that can be taken in, because the thyroid gland selectively uptakes iodide. Selectively uptakes iodide because thyroid hormones are synthesized in the thyroid gland, and one of the components of the thyroid hormones is iodide. It's a precursor for the thyroid hormones. So since there's no iodide in the molecular iodine oral care products, and also since the thyroid gland does not selectively uptake molecular iodine, there's no more molecular iodine in the thyroid gland than there is in any other tissue in the body. So this is really not a concern. If there is a concern on the part of a patient and somehow or other they think that they're allergic or sensitive to iodine, then one thing, if you speak to any allergist, they'll tell you there is no such thing as a true iodine allergy. You can't be allergic to something that your body requires. Now, people may be sensitive to different levels of iodine, and there have been reactions to povidone iodine, but there's a lot of things in povidone iodine besides iodine. So, if someone is concerned about it, then what I would do is I would just take a few drops of a molecular iodine oral rinse. If they're concerned that they have an iodine allergy, place it on their bare upturned forearm and let it sit there for a minute or two. And if there's no erythema, if there's no swelling, I wouldn't be concerned about it at all. Okay. There were two double-blind studies that were done on canines, and these dogs were in kennels, so these trials could be carefully controlled, and these were gingivitis studies or plaque reduction studies. And what they did was they took a few drops of the molecular iodine and put it into the dog's drinking water in the treatment group. There were 25 dogs in the treatment group in each one of these studies. And remember, we said that iodine is an essential nutrient. So the amount of iodine that was put into the pet's drinking water each day was within nutritional guidelines. Okay, so this is not anything more. So think of it as a nutritional supplement. It was nothing more than what their bodies would want or need. And in addition to that, they had a control group or a control arm to the study with another 25 dogs who did not have iodine added to the drinking water. What they found was after 1 month that the dogs that had the iodine added to the drinking water had 44% less plaque than the dogs that did not have the iodine added to the drinking water. 44% less plaque. So just file that in the back of your mind for a second. What makes that important is that there was another study which was published in the Journal of Veterinary Dentistry. And in that study, it was a study of veterinarian supervised brushing of dogs' teeth, where they brushed the dog's teeth either every day or every other day or once a week. And they found that with weekly brushing, that they were able to achieve a 9.9% plaque reduction. With every other day brushing, a 24.8% plaque reduction, and with daily brushing, a 37% plaque reduction. Okay, whether it was daily or every other day or weekly, every one of those were significantly less plaque reduction than was achieved by simply putting a couple of drops of molecular iodine into the pet's drinking water each day. And they didn't have to hold the pet's head still every day, each day for a month in order to be able to do it, which they needed to do if the dogs would even let them with the brushing. So much easier and more effective. Okay, Waterpik has done some of their own studies, and what they found was that just by rinsing in the mouth, that rinse can reach to 21% of the depth of a 6-millimeter pocket. Well, since we're concerned about the periodontal biofilm, which is at the base of the periodontal pockets, then it's good to know that with the pickpocket subgingival tip in a Waterpik or an oral irrigator, that delivers an irrigant to 90% of the depth of a 6-millimeter pocket. So if you add the combination of adding some molecular iodine to the water in the Waterpik, then you wind up not just with irrigating with water, but you wind up with irrigation with an effective medicated solution. I've been doing that for 5 years myself, and I think it's terrific. Okay, I think you all would benefit by hearing some remarks by Dr. Garg. Dr. Garg is one of the preeminent implantologists in the United States. He's probably taught more dentists how to place implants than probably anyone else at this time. So let's hear his comments on
such an impressive background.
periodontal. For our audience, can you just share a few of the highlights of your background?
I was a full-time professor at the University of Miami, the medical school there, in the Department of Oral Surgery for about 18 years. And during that time, I authored books, published articles, trained residents. In addition to that, is we've taken what I did at the university training folks and started training folks in long-term comprehensive implants and or bone grafts. It's under our brand Implant Seminars. And in those comprehensive programs, we have trained more general dentists to confidently place and restore dental implants than anyone out there by far. Is 20,000 dentists we've trained, and we continue to train dentists to confidently place and restore dental implants. And we do these programs all over the country, so it's convenient for the doctor, the dentist, to attend. We do them in Houston and Dallas and San Francisco, Los Angeles, New York, Boston, Miami, in every major city, as well as the virtual option.
And what role or responsibility does the patient themselves have in this? What can they do at home in order to be able to enhance the health of their implants and their entire dentition for that matter?
They've got to focus on taking care of it. And unfortunately, a lot of times, especially the fully edentulous patients, they were the ones that lost all their teeth. And they didn't lose their teeth because they had ideal home care or ideal motivation. Those are the ones that probably had the poorest home care, the poorest motivation. And now they get an all-on X or an all-on 4. Now they got their teeth back, but they still come from that mindset of not really taking care of them. And some of them, on top of it, you overlay, they think that, well, after I paid all this money, I shouldn't have to take care of them. On top of that, you overlay the fact that is the way the all-on-4, all-on-X is designed oftentimes is difficult, if not impossible, for the hygienist to get up underneath on those abutments, and impossible is, if not super difficult, for the patient to get up underneath, is with brushing, with flossing underneath there. So it's got to be liquid. It's got to be something they can get in there. And it's got to be something that's antiseptic that they can get in there, because brushing and flossing on those kind of cases is very difficult, if not impossible. And even on single implants and 300 bridges is where they may have better access. They've got to get the mindset of doing it. It's got to be home care. It's because they can't is just rely on seeing the hygienist is twice a year or 3 times a year or 4 times a year, whatever the frequency may be. The patient can't be expected to educate themselves. They've got to be educated by the dental office. And they got to be educated, number one, home care is extremely important. And number two, the type of home care that's going to be important. Brushing alone is not going to do it. Flossing alone is not going to do it. Brushing and flossing alone is not going to do it. In fact, there are major studies, and more than one, that show rinsing will remove double to triple of what just brushing and flossing will do. That's just amazing that with rinsing, is that will be double to triple as effective as brushing and flossing alone. And numerous studies show that. Other studies show that even within the category of antiseptic mouthwashes, and there's probably in the dental industry in America about 8 different types of antiseptic mouthwashes, all of them will do twice or 3 times as good as brushing and flossing alone. But some of them clearly will be better than others within that 8. And one of them that's been shown to be the best out of that, or certainly one of the best, is molecular iodine. So number one, we've got to train the patients that they've got to add rinsing, especially in tough to reach areas like the all-on-X's and all-on-4s, but pretty much every implant case, they got to add rinsing to it. And then one step further, if you're going to have them add rinsing to it, it's up to us, the doctor's office, to tell them what to rinse with. And so pick out of those 8, not others that don't have antiseptic in it for sure. And then if we're going to pick from the antiseptic group, let's pick one of the top ones.
Okay. All right. So if you're either contemplating doing or you're already doing implants, so let's see. let's see if we can keep you out of trouble a little bit here. So uh, there was uh, there was a study that was done where data was taken from the National Practitioner Data Bank. What they did was they took a cohort of 16,118 malpractice lawsuit cases against dentists and also against dental hygienists. And they examined to see what were the top five claims in these malpractice lawsuits. And one of the top five claims was that the dentist or the dental hygienist either supervised the neglect of my teeth or they failed to treat my condition. All right. So if it's really good reinforcement, even if you've been taught this over and over again, please make sure that you document your patient referrals, that you document your treatment recommendations, and also your home care recommendations. Because if you don't have it written down and if it's not contemporaneous with the time that the advice was given, then you have liability. Because if it's a he said, she said, if it's the patient's word against yours, and you don't have documentation to back it up, then you're at a big loss. No matter how conscientious you were, and no matter how good your advice was, it must be documented. All right. And also to that point, it's also really important for the patient to understand their responsibility and their role once an implant has been placed. It's not enough for them to feel that, okay, they spent a lot of money, they had this implant done, and that's the end of their problems. It's not the end of the problems. You saw the statistics on peri-implantitis, on peri-implant mucositis. These are not pretty statistics. And later on, 8 years from now, you have a patient holding an implant in his hand or her hand, and all they remember is that 8 years ago, they spent a ton of money. They didn't go on vacation. They didn't get that new car because they got that implant instead, and now they're holding it in their hand, and they don't remember that what you advise them to do, that you advise them to be on a molecular iodine rinse every single day at home, or that you advise them to see a periodontist, or that you advise them to see an oral surgeon, or that or you advise them for treatment in office, and they rejected it. You need to make sure that they understand, because once you've placed the implant, you have the education, you have the training, you have the responsibility for doing as good a job as you. The best work can be lost for patients who don't take care of their implant at home. And it's not because they don't try. It has to be effective. And we've gone over some of the principles with you as to what is effective, what's the most effective that we know of. And it's up to you to ensure that the patient knows about it and that they're encouraged to do this on a meticulous basis at home, because a patient's meticulous, effective daily home care makes a difference between a failed implant and a long-lasting implant that everybody is happy with. So document your home care recommendations and make sure the patient understands their responsibility. Okay, so with that, we're coming close to the end here. So let's spend a little time getting some questions answered. And if we don't get to all of your questions, just feel free to email me at Iotech International. And if we didn't get it to it tonight, we'll try and get that answer for you. Okay, so let's see what we have that way of questions here.
Question about, is this for all implants, including denture implants?
Yes.
Okay.
Yes.
If we know that bone loss is sometimes common around implants to the first thread, if this remains stable radiographically and clinically, should there be any intervention other than hygiene as long as it remains stable?
As long as it's stable and the tissue looks healthy, and then it has all the characteristics of healthy tissue, then that should be sufficient.
Okay, question about, are water flossers better than flossing?
Once somebody has developed periodontal disease and has developed pocketing, or there are pockets around an implant, then then flossing, the floss doesn't get down to the base of the pocket, but an irrigation can. So I think it's much more important, particularly important for anyone who has periodontal disease or for which implants are being placed and you want to protect them.
What is the recommended protocol for either implant condition in regards to cancer patient referrals from our medical colleagues prior to radiation and chemo? Good question.
Okay, where is that question?
That is, well, it's about 4 below the one I just answered. Or
Okay, all right, just repeat it, please.
Sure. What is the recommended protocol for either implant condition in regards to cancer patient referrals from our medical colleagues prior to radiation, chemo, etc.?
So they're asking the patient is going to be receiving a cancer treatment.
Yes.
And already has an implant placed.
That's what I believe.
Okay, so if the implant is placed, so if the patient is going to be undergoing cancer treatment, so it could take primarily you can take one of two forms, either chemotherapy or radiation therapy. This is separate from any surgical therapy. Then if they're going to be undergoing chemotherapy or radiation therapy, then there's a very good chance that they're going to be getting oral mucositis.
Okay.
The incidence of oral mucositis for patients that are receiving head and neck radiation approaches 100%. The incidence of oral mucositis with patients who are undergoing chemotherapy is north of 40%. So,
okay. Can molecular iodine rinse be used immediately with the implant with some grafting or platelet-rich PRF, platelet-rich fibrin?
Molecular iodine can be used as part of the grafting procedure. So there is no contraindication for the use of molecular iodine at the time of grafting at all.
Okay. How can we make sure that molecular iodine is really used? Any recommended brand? Stay tuned. If you stay after this presentation, you'll hear information on Iotech International's molecular iodine. Hand scrubs and skin prep use 2 to 3% chlorhexidine, or does the molecular iodine taste bad?
You said hand scrubs use 2 to 3% chlorhexidine gluconate, or
That's
what?
A comment.
Or does it taste? Or does molecular iodine taste bad?
One is a comment, and the second is the question. Does molecular iodine taste bad?
Molecular iodine basically doesn't taste in the formulations that are being used in dentistry because there's flavoring that's put in, and generally it has a pleasant mint taste.
Is it safe for a hyperthyroid patient?
Yes. The use of oral care products with molecular iodine are safe for patients who have thyroid conditions.
Does molecular iodine change the oral microbiome?
Yes, it does to a slight degree. It winds up favoring the distribution of aerobic bacteria or the beneficial bacteria. Initially, it will kill all types of bacteria that it comes in contact with, all types of bacteria. But because the aerobic bacteria grow more quickly and then, or regrow more quickly than do the anaerobic bacteria, it favors the regrowth of the aerobic or beneficial bacteria.
Okay, so there was a question here about mixing iodine with the bone graft material. Is that possible?
It's being done right now.
Okay.
It's very, very tissue friendly, and it's not a subject of this discussion, but it's also being used in wound healing, including grafting procedures.
Okay. We are 6 minutes over. I think we're going to have some of these folks reach out to you directly so we can bring Angelique on. And your contact information is at the end of your presentation. So for those of you on right now, of course, your presentation, or Dr. Moskowitz's presentation includes his contact information. We have several hundred questions here. What we'd like you to do is reach out to him directly, and he can answer your questions. And we're going to go ahead now and talk about Iotech International's molecular iodine products. If you'd like to stay on for a few minutes, I know that Angelique is going to provide you with excellent information. So let's go ahead and bring Angelique up.
Okay. All right. Thanks for your time. And I'm sorry if I didn't get to your questions, but I'll certainly get to them if you email them to me. And again, thanks so much.
And at the top of your screen, everyone, we are posting a link to Iotech International. And if you tap on the banner, give me 1 second, it's going to take you right to their landing page for more information. And you can, I believe, order samples and that sort of thing. So welcome, Angelique. I'm going to go ahead and turn it over to you.
Thank you, Dr. Rowling, and thank you, everybody, for staying on for this portion of the webinar. I'm here to give you some information about products containing molecular iodine that can be used for everything that Dr. Moskowitz discussed within this webinar. So these are all products that are available from Iotech International. They can be obtained through our website. And if you click that banner at the top of the screen, you're able to request samples, brochures, literature, and get more information by filling out a quick form and submitting it to us, and we'll get back to you for any follow-ups that you may be requesting. So the first product that we're discussing tonight is our IoRinse Ultra. IoRinse Ultra is our first OTC drug product. This is a ready-to-use formulation of a molecular iodine. There's no prescription necessary for IoRinse Ultra. This comes in a soft mint flavor. I know somebody did ask about flavoring earlier. IoRinse Ultra is available in a 1 liter size bottle as well as a 16-ounce bottle. So the 1 liter bottles come 12 1 liter bottles per case. The 16-ounce comes in 24 bottles per case. This is the prices that you see on the screen are wholesale pricing, and these are available through our website in the professional store. So if you're looking for case quantities of any of the products that we're discussing, they are available in the professional store, and the pricing here is case quantity wholesale pricing. Next, we have IoRinse ready to use. So IoRinse RTU. Some of you may be familiar with this product. This is one of our first products that we had from Iotech International. IoRinse ready to use is available in soft mint flavor. It's also available in the green apple flavor. Now, the soft mint flavor does contain xylitol, which is also has its additional benefits. Soft mint is also a very subtle flavor, whereas the green apple has a stronger flavor. So that is very subjective, depending on the person's personal taste. IoRinse ready to use available in 1 liter bottles, 12 1-liter bottles per case, and also available in 16-ounce bottles, and there's 24 bottles per case. IoRinse Ultra and IoRinse RTU are both ready-to-use formulations. They can be used for daily rinsing for your patients at home, and they can also be used in office for pre-procedural rinsing. Next, we have our IoRinse Concentrated Arrogant. The Concentrated Arrogant is available in the green apple flavor. It comes in a 1-liter size bottle with 12 1-liter bottles per case. The Concentrated Arrogant is the formulation that would be used in a water flosser for at-home use, and it can also be used in water tanks for irrigation for in-office use. This product is diluted for use. So a patient would add 30 milliliters of the Concentrated Arrogant into the tank of their water pick, and then they would fill the remaining the tank with tap water and floss as they would normally do. IoGel Tray Gel. This is a thicker formulation of the molecular iodine. IoGel is used in a periodontal tray for at-home use. The patient would fill the tray with IoGel, place the tray into their mouth for about 5 minutes. Then they spit out the excess and remove the tray, spit out the excess. IoGel is available in a 12-ounce bottle. There are 12 bottles per case. This is a full line of our the products available from Iotech International. You can ask about any of the products that you see here by filling out that form at the top of the screen. Just click the banner. We do have a full line of products. A lot of these are also discussed in Dr. Moskowitz's other webinar through the Dental CE Academy. So if this is something you're interested in, we can get you information for that as well. And we do recommend you checking that out for even more information regarding molecular iodine as well as oral rinses. All of these products are available in our professional store as well as our consumer store. The professional store is for wholesale quantities, and the consumer store is where if you don't stock products, you can send your patients and they can purchase with no prescription necessary, and they don't need to make an account. This is this QR code on the screen. It takes you to that to the same link that's at the top of the screen. So if you're unable to visit the website now, you can take a screenshot or save this link for later. And we do office learns as well. So if this is something that you are interested in for you to take back to your office, please let us know through that contact form. We will be in touch with you to schedule a virtual office learn, provide free patient brochures for your office, and answer any questions that you may have regarding Iotech products. In 2018, clinicians did an evaluation of our ready-to-use rinse as well as our concentrated irrigant. In this evaluation, there was 250 patients. 125 of those patients used the concentrate in a water pick at home. 125 of those patients used the ready-to-use formulation. The patients were taken from 50 offices, 5 patients per office. And this just gives a general overall rating of what they got from the evaluations and the feedback from those patients. As a result of this evaluation, clinicians report did list the products in their buying guide as a best product for 2019. As a result of further evaluations, the products were listed as best products for 2022. Again in 2023, and we just recently found out, and they were listed as a best product for 2024. All of this literature is available from Iotech International. If you do want us to send you a digital copy of the articles, we'll be happy to do that. These are just a few of many key opinion leaders that do recommend the molecular iodine products from Iotech International. Again, these are more articles and literature that are available. And if you do have any questions, please feel free to include that in that contact form, or feel free to reach out to us at our office through email or by giving us a call, and we'll be happy to answer any questions that you may have. We do know that some offices are offices that stock product to provide easy access and convenience for your patients. This is just a quick illustration of a projected profit that your practice can see as through the sale of IoTech products. So we do make our products available at wholesale pricing. And in addition, we also offer bulk pricing. So bulk pricing is 10 cases or more, you receive an additional 15% discount on that order. If you are an office that stocks product, this gives you a great discount and also a lot of room to make a profit in your practice through the sale of the IoTech products. If you are interested in bulk ordering, please feel free to reach out to us. We'll help you out with that. You just contact our office, and we have a customer support team that can answer those questions and get you set up with that additional discount. In an economic comparison of oral rinses, the molecular iodine oral rinse, even with all of its benefits, is still one of the most economic solutions for use in your offices. These prices are standardized to 1 liter size bottles, and these are based on professional pricing. Our contact information is at the bottom of the screen. We are available Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time. All of the products are available directly from IoTech International. Our shipping is usually either same day or next day, depending on your when you order. And this is just a quick breakdown of the pricing of the molecular iodine products based on wholesale case quantity pricing. So if you do have any more questions, we will answer any product questions at this time. If we don't get to your question, we will, please feel free to send us an email through our website or give us a call at the office, and we'll be happy to answer those questions for you.
Angelique, is it better to use molecular iodine instead of chlorhexidine prior to periodontal treatment to reduce bacterial load?
Yes, absolutely.
Okay. Any staining issues with molecular iodine?
Not in the recommended use.
Yes, with recommended use, there's no staining. I also see a question about if molecular iodine is clear. In the formulations that we have, the molecular iodine has a slight amber color. So it is a light amber color. If the solution is clear, like completely clear, it does not contain molecular iodine. Now at much lower parts per million, the color does lighten. So it can appear to be clear.
Is there an affiliate program to resell the product?
Yes, we do have an affiliate program. We have a brand ambassador program. So if you are interested in our brand ambassador program, you can say that on the form, and we'll be happy to get you started doing that for sale to your patients.
So they'd access the form again by tapping that red banner at the top of the screen.
Yes.
You can also access it in the chat area. I'll repost it again if that banner does not show up on your device.
Also added the QR code if you want to scan.
Or the QR code. If you're not on your phone, you can go ahead and scan that. Is the gel and tray delivery as effective in getting to the bottom of the pocket as the water pick attachment on the water pick?
Dr. Moskowitz?
The answer, if used correctly, absolutely, and also it lasts longer because the gel, because of its viscosity, is retained within the periodontal pocket longer.
Is there a concentration for the in-office treatment versus the at-home treatment?
Yes, I would recommend for in-office subgingival irrigation. I'm talking about with a syringe and cannula that I would use the iRinse concentrated irrigant at full strength. That would be 300 parts per million.
Okay.
There are periodontists that are using this now with excellent results.
When will this product be available in Canada?
If someone is interested in that, they should drop us a line, because we're currently working with Health Canada to get these products on the market in Canada. So we would like to think it would be later on this year, but if we have their information, we're happy to give them a heads up when it does become available.
Question here. I know it might be out of this great presentation scope, but is it to be used for periodontitis too?
It is being used for periodontitis.
Okay.
It is being used.
What is the difference between ready to use and the Ultra?
Both of them contain exactly the same amount of molecular iodine. So there's a slight taste differential, and also and that's a very subjective thing about who would like which taste better. And also the iRinse Ultra contains, in addition to the molecular iodine, contains chlorhexidine gluconate. Acetylpyridinium chloride. My bad.
Yes.
Can IOGel be used on contaminated, exposed implant threads?
Yes.
Okay. I'm going to go up to some of these other questions here, because we do have a few minutes and we have Dr. Moskowitz here. The concentrated version says 1 capful in the reservoir and the rest you fill with water.
That's up until 300 parts per million. So 1 capful, it's actually a 1:9 ratio. Since 1 capful contains 30 milliliters of water, by adding 1 capful, you're adding to the empty canister, you're adding 1 capful or 30 milliliters of the molecular iodine concentrate. And then you're adding to that, you're filling up to the 300 milliliter mark by adding 270 milliliters of water. So it's a 1:9 ratio, and you're getting a total of 300 milliliters of solution as the irrigant.
Do the patients start the molecular iodine rinse the same day the implant has been placed, or is there a time frame to start after placement?
The sooner, the better.
Do you
We've
have
seen excellent results with tissue healing, wound healing, and as soon. In fact, it's being used during the procedures, during surgical procedures, and post-surgical procedures.
Is it affected by toothpaste, anionic, and cationic?
Well, it's not a good idea to. The last thing I would use would be the iodine, and if you had an opportunity to space it out, either before you rinsed out afterwards, or if you're going to rinse, or if you're going to be drinking something, so to give it at least 5 minutes.
Do you have your patients sign a form of understanding once the patient responsibilities are explained, for instance, implant recommendation, surgery?
I think that's an excellent idea. The clearer the understanding, the better it is.
Do you recommend a daily preventative rinse regardless of an implant placement?
Yes.
Absolutely.
Yes.
If the patient is resistant to antiseptic mouth rinses, is there any contraindication for letting them mix with a little scope or taste just to get them to do rinsing with antiseptic mouth rinse?
If a patient is resistant to antiseptic mouth rinses,
They don't like.
I think resistant meaning adverse to the taste.
Yeah, they don't want to do it.
they don't want to do it.
Well, but they use
Well, it comes in different flavors.
Yeah.
So
and the soft mint flavor especially has an extremely subtle taste. Some people just say it does taste like water. It's so someone who's resistant to using it,
I would put the
Yeah.
concept of iodine out of your mind completely when we're talking about taste, because no one will experience an iodine taste from all the experience is different flavors. Then it's very subjective as to which flavor they like. And that's no different from an antiseptic rinse from a non-antiseptic rinse. It's strictly a matter of flavor at this point.
Yep.
So it's preferred to use it, give 5 minutes, and then you can brush?
No, I would, well, I would brush before I rinse. The last thing I would want to do is to rinse.
Okay. What's the optimal time for swishing?
If the patient can tolerate 60 seconds, then I think that would be ideal. If not, they'll get tremendous benefit with 30 seconds. Almost all the testing was done to 30 seconds. But it's a known phenomena that if you keep it in contact longer, you get better results.
Molecular iodine seems more simple than povidone iodine. Why did researchers in the past move away from molecular iodine and move toward povidone iodine? Seems backwards.
Well, they didn't start with molecular iodine because it wasn't available. This is a whole long story, but suffice it to say that that iodine has been traditionally for decades it's insoluble. It's almost insoluble in water. So it wasn't until 1955 that NASA researchers were able to develop a water-based solution of iodine, and then they had to use polyvinyl pyrrolidone as an organic molecule to bring iodine molecules into solution, because otherwise they wouldn't go on their own. And there hasn't been an important advance in iodine chemistry since 1955 until the advent of these molecular iodine solutions. So it's the molecular iodine solutions that came afterwards. Even though it's the active agent in povidone iodine, and it's the active agent in any iodine compound, the biocidal agent, even things that were in use, natural substances that were in use decades ago.
Question here, is there any health condition that a patient should not use? For example, ulcerative colitis or Crohn's?
Actually, patients that have ulcerative colitis or Crohn's disease are prone to mouth ulcers, and they would benefit from the iodine.
I actually have a first-degree relative that I buy the product for, and she has ulcerative colitis for that very reason. So she's been using iRinse now for probably 2 years. Why the addition of cetylpyridinium chloride to the Ultra Rinse? Isn't the iRinse more effective than the cetylpyridinium chloride?
Okay, so that's a good question, and it was not because of efficacy reasons that it was used. The only reason that cetylpyridinium chloride was added was so that claims could be made, drug claims could be made, because cetylpyridinium chloride has been accepted by FDA for decades as a safe and effective anti-gingivitis and anti-plaque agent. So by adding the cetylpyridinium chloride to the iRinse, that we were allowed to make claims that we otherwise would not be allowed to make.
Question here. It can be daily used for healthy teeth, right? Or is it better to use it for a certain period of time and then off, not to disturb the normal microbiome?
Well, there are thousands of patients that have been using it every single day for years. and with no adverse events or no adverse effects. So I think that the benefits of using it are far outweigh uh, the um, uh, the idea of using it on an episodic basis. And I don't want to get into making claims here. Not now. This is not an appropriate time for it. But I can tell you, molecular iodine is so effective for. I'm not talking about any specific product. I'm just talking about molecular iodine in general. It's so effective as an anti-caries agent. It's so effective as an anti-periodontal disease agent. It's effective for mouth sores. It's effective for a number of different things. To me, it's just a win, and it's an essential nutrient.
Question about, is it effective in disinfecting for norovirus and Clostridium difficile spores?
Okay, so molecular iodine has been tested against norovirus, and it's completely effective against norovirus. No question about that. As far as C. diff, I can tell you that molecular iodine solutions have been used against Clostridium sporogenes and Bacillus subtilis, which are the two spores that FDA promulgates as the spores to be used in spore test strips to be sure that your autoclaves are working properly. And they chose those two spores because they're considered to be amongst the most difficult to kill of spores. But it's not just a simple answer by saying, yes, it kills this or it kills that, because it depends on the concentration. It depends on the contact time. So there's a whole bunch of things. So there are instances or cases where, depending on the circumstances, where it is absolutely sporicidal, including C. diff. However, that doesn't mean that in a specific case, if it's used briefly or is not in contact long enough or not in a high enough concentration, that it will be effective for that purpose. So that's, you can't answer that question with limited information, but it can be. It's absolutely could be sporicidal.
Okay. We've reached the end of the internet here. We've gone over a few minutes. Thank everybody for attending and staying on. Anything you'd like to say in closing, Angelique or Dr. Moskowitz?
You will be getting a follow-up with our contact information and another opportunity to fill out that form. So you will be receiving an email from us tomorrow for a follow-up. That's something you can take back to your office and share with your colleagues.
Yeah, and I would just mention that for those people who were asking questions about the taste and how does it taste? Does it taste like an antiseptic? That the best thing to do is that I think is happy to provide free samples of the rinse.
Yes.
So if you just click on that button on top and request samples, then we'll send it to you, and then you could judge yourself what it is. It's not going to cost you anything, and it'll be our pleasure.
Great. Thank you, everyone. We are going to then log out and redirect you all to the quiz. It will also be sent to you via email within about 5 minutes from noreply@clickmeeting.com. That is the same email sender as the confirmation email that you received. I want to thank everyone for being here this evening. We've got great comments. Dr. Moskowitz, amazing course and everything. It was amazing. Check out our website. Dr. Moskowitz presents another course called Oral Rinses, What's Safe, What's Effective. You'll get the whole comprehensive background on molecular iodine. We have Pam Cushionen coming up next week to talk to you about the periodontal inflammation and its connection to systemic health. And then I present a course on oral mucositis. So please go to the website and sign up. And good night, everyone. Thanks for being here.
Thank you.
Thank you, everyone.